Okay. Yeah. So I was saying that as part of our quality assurance mechanism in our programming, we, as the board, would want to ensure that we have staff that are qualified and competent and well experienced that are serving in different programs that are being undertaken by the organization. So another is needs assessment. So we expect that the management, when they are designing their programs, they should design it based on needs that exist within the community. And if these needs, how do they then map out? Because at times, being someone that has been there before, I know that sometimes these calls really come at short notice, that it can practically be difficult for you to even do a needs assessment. In a case as such, we expect that the management can use secondary data that exists, that has been, for example, been conducted by or collected by a partner or an organization or government or any other form of secondary data. And also this secondary data can include reports, previous reports of projects that have been undertaken. This can provide a very useful way of designing projects that are really needs driven. And yeah, in an event where really the management is able to do a needs assessment, that is very, very critical to be undertaken. This helps for us to have some kind of quality in our programming that really meets the needs of the communities that it seeks to serve. The other is the do no harm approach. This is very important. We expect that whatever the programs that have been designed or that are being undertaken by the organization, it has to be implemented in a way that does no harm to its participants. So that means the strategy should be something fine, as well as reporting, as well as implementation, and so much more. We'd not expect a situation where you're having a training, let's say, for example, and then these people are walking to the training from a distance of, say, 1 kilometer or 4 kilometers or 3 kilometers, and you do not provide them with, let's say, some kind of transport, and you also end the training late. Say you're ending your training at 7 or at 8, and then after that, you expect that these people or these participants go back to their families at such a time. That is really a high risk that we are placing these participants in. And so we would not want such a thing. We want to make sure that whatever our approach is, it does no harm. Yeah, in such a case, like the one I've given, these participants could fall into a victim of, say, rape, GBV, and so much more along the way. And we really do not want anything like that. Most important is we want to trust building. Trust is like the cornerstone that we use as a way to basically achieve some kind of, say, cooperation, as well as community participation in our programming. If they are able to trust our programming, our programs are more likely to succeed. And so it's as simple as that. Okay, so so happy that finally we need to be discussing progress of the strategic plan. And here we'll be discussing milestones, whether it being in programs, in finance, in governance, operation, challenges, and recommendation. And this is really going to be more like key highlights that Benson is going to take us through. Oh, Benson is not here. Okay. Benson is not here. Okay, so since Benson is not here, we can move on to something else, and when he comes, he can pick up from there. Any questions, ladies and gentlemen? This is it for my presentation on day 2, and yeah, Irene, yeah, would you mind to go?
Okay, thank you for the opportunity again today. Prayers, it was necessary, and today I joined a little bit late. I don't know if we prayed because every single day that you're able to breathe, it's a testimony, but it's okay.
Yeah.
Thank you for the chance, and the presentation was just powerful.
Thank you. Thank you so much.
And it's really good. There's something that I did not see.
Yeah.
Maybe as I was engaged somewhere else, maybe you discuss, I don't know. You can also correct me. I did not see the motivation strategies of the organization, like maybe if one of your staffs perform well at the end of the year, what do you do?
Yeah.
Or do we promote? What do we really do to
yeah.
Our members that work with us? Yeah, I did not see that. Not see.
Yeah.
And ways, because an organization that is registered, you cannot come in anytime you want, and you cannot leave anytime you want.
Yeah.
You know, so that's mean if you want to resign, what are you supposed to do?
Yeah.
Yeah, so those are the areas I think I miss out, in case you explain.
Okay.
Yeah.
Okay.
Thank you.
Thank you. Thank you so much for a very important question. Actually, staff appraisal, which is what you're discussing, which is what your question is actually about, is something that Benson is coming in to talk about. That is part of Benson's presentation. So I would not want to preempt the presentation of Benson. I think when Benson comes, Benson, I believe you're hearing, you please take note of this question and make sure you have it answered. And then regarding the prayer, I think that's totally right. We did not have that done, but yeah, we've totally taken note of this. I think it's very important to do so. Yeah. Okay. Can we have like a 5 minutes break of sitting? At least a 5 minutes break from this sitting, and then after which we can come back and then Benson can take us through. 5 minutes, that means we would get back at there should be 2:40, right? Is it 2 there now?
Yes.
Yes. So we get back. Okay, so we get back at 2:40, and then Benson will be discussing the strategic plan, progress of the strategic plan, as well as many other things, including the appraisal, which you have asked about. And Peace will be coming after Benson, to discuss finance and audit. Yeah. So, okay. Once again, thank you so much. Please have these 5 minutes to stand, shake your body, grab some water, and we get back at 2:40. Colleagues.
Okay, thank you very much, Chair, and thank you, everyone. Unfortunately, I don't see Emmanuel again. I was trying to follow him on phone, but I don't know what happened. Yeah, but what I'm going to share here is it is almost a multi-purpose thing. It encompasses several things. Now we're supposed to do a presentation on the annual report, both finance and programs. But we realize that currently we have our annual reports are still projects, right? Because it is donor demanded. So we'll share what we have briefly. So looking into the 2023 strategic plan as of August 10 to 2020, in fact. So there were a couple of things looking into the 4 programmatic areas, but the focus was to create an enabling environment for healing, peaceful coexistence, and community well-being through reduction of protection risks, including division, hate speech, trauma, violence, conflict, climate change, gender-based violence, among others. So this is the goal for 2021 and looking into our annual plan. With the specific focus in terms of budgeting, looking into the 4 programmatic areas, which is livelihood, education, environmental conservation, and peace building, where the annual plan budget is forecasted to be 240,240,200 shillings only. Along the way, we are able to realize from particularly donors, we are able to realize 123 million shillings only. This is for year 1. And we are rating this from the month of January 2021. Meaning that when you look into what is required, suppose to make us achieve our programs, for our 4 thematic programs, we needed some more 117,242,000. So now this becomes a challenge to us as management for us to accomplish the set objective. So what currently we're doing in the absence of the board, and which we see as a team management that we can be able to do very well, is to close that gap, is embarking on resource mobilization. So this resource mobilization are focusing into donors and the other partners. So to this far, we are able to submit proposals. We have submitted already to UNESHARA, the aim of fixing that gap, also to feed the mine. And then also we are able to submit a proposal together with Oxfam to War Child Canada as a consortium. So these are the things that are happening. And today, as you put there, like saying, working on a proposal that to be submitted to Canada Challenge on mental health and the democracy bus. Good enough, this morning, we're also able to submit that proposal to Canada Challenge. And we are also making sure that we complete some of these proposals, like for UN democracy funds and so on. So these are the strategies that we really putting at place now to cover up that deficit. And then now it almost becomes late because the year has come to an end. Looking into our achievements or milestones in 2021, we're able to get some few funds, like for this year under the funds from European Union. For this year, we're able to get 42 million shillings. That covers this year from January up to November, which has come to an end. And we have a project that is being funded by Oxfam. Also, that project is worth 52 million. This is under the thematic area of the peace building being implemented in Bidibidi. And then we have funds from Children's Rights and the Violence Prevention Fund. This is a consortium project. You see it highlighted yellow because we could not establish exactly how much is CECI getting from this, because it is a joint project which has been implemented by two partners. In the course of the year, we were able to achieve, to get some award, which is worth 60 million, which you can see also there. So we have made a breakdown, a summary of the financial statements on the current projects, which you can see it there. So we realized that, yes, the funded the EU project runs for 3 years, and we have exhausted 1 year, and we still have funds to carry forward for, they said, 2 years. For the peace building, you see the 52 million. What we are left with now, it is a 6 months project, but we are left with only 8 million to be spent for this year. Then we projected it, the CRVP project, which is that project is on livelihood. That falls under our thematic area of livelihood. So we projected it to be 35 million, though we're not so sure. It runs for 2 years. And then the 6 million, we have not yet spent that money. Yeah. So that is that. Moving forward, this is now under the programmatic results. In the course of the year, with our targets, we are able to see those results. I don't want to get into those details, but I will share with you this presentation at a certain point, because this would have come also actually in the annual report. But I thought it's wise that we could be able to share here. This is under peace building project, which is Sawa Salamat with Zone 3. We are able to reach a number of people, and using the principle of 70-30. So this data is being segregated according to the sex. It is summarized here. You will see that in the chart here that we have 70% based on the number means we are able to reach, because our target is to reach 18 people, both the host and the refugees. So when you look at the blue indicates the number of people reached. So we are about 13,000 plus people that we reached. We covered with the small funds we got in Zone 3. And the host, also you see, they are supposed to be about 4,500, and they were able to reach close to 3,000. We see something red somewhere, the blue achieved, the yellow is in progress, and then not in progress. You see that it's actually there's nothing in a way. But males, when you look at the males, the number of males reached and the females, so it is all segregated there in this level. So under education, you see our project in Koboko municipality solely falls under education and protection. So, and it is one of our components, our programmatic area. So the target for this year is 7,000 people, both the refugees and the host community. And yeah, but we were able to really move. When you look at it, the figure there, the figure 2 below is showing the data from the different interventions segregated by sex and status. So this is what happened in Koboko municipality. Something that we did not do from healthy campaigns. We were able to reach that figure there, and then both direct and indirect. And then we have the debate, that is direct. And then we have the inter-school debate actually activity, which is done, and they reached that figure. Then we celebrated the International White Cane Day. Only we are not able to do sport events because of the lockdown, and this has been the major challenge. So the target achieved, when you look into the graph here, we have the public healthy campaigns. The target was 2,000, but when you look at the target reached is 4,050. And then the school debates, the target was 50 participants, and they were able to reach up to 116. So the celebrations, we targeted 100, but we were able to cover it double. Something that is not done, which is 140 participants to be reached, the debate, the sports events, but we are not able to do it. We pushed it to year 2. Yeah, the challenges were encountered in the course of the year. You know, the continuous lockdown due to the outbreak of coronavirus affected most of our implementations for the strategies put in, the interventions put in place. So it became quite so hard. That explains the reason why the sports event were not able to take place. And even if other activities took place, but it was through thick and thin. We also have limited resources when you, to recruit competent and experienced project team. You know, the project, we needed results always. And that is one thing that makes us to be different sometimes, and get also trials and so on. But the little resources makes us really sometimes compromise with the quality in this regard. We have also the absence of the board, of the directors, who are going to perform their role so much, supporting the management, I mean, getting in, advising, and doing all that which is necessary. But also so much taking their role in the resource mobilization was not really there. But I'm very happy that now we're on, and that things might move in a different direction. So we have the incomplete operations policies, which affects the donor relation. We have most of the policies, you see the finance policy, the logistics, the operations policies generally, the human resource policy, all they are incomplete. Actually, there are a lot of things that need to be put in place, and that is something that is worth bringing it as a challenge. We have limited field staff, female staff. This is something that most partners have been talking about. They needed more female staff to be part of the management. To say that particularly our partner Oxfam is so much deliberate about the female staff. We suggested some recommendation here that one thing to look into, have to be much flexible enough in the implementation of the project activities in regard to the government guidelines on the COVID-19. And that's something that really helped us to move to this far, though with a little bit with the deficit, but at least we are able to cover up some few things. We have also taken a deliberate action to do resource mobilization. When you look at the funding, I mean, the proposals that are already submitted and the others are to be submitted, though we know very well that these proposals, it's not a guaranteed that when you submit, you get funds, but at least that shows that people are focused and they want to really get something good. to achieve the objectives. Like the board chair presented, we get these resources from different people, from well-wishers, from donors, friends, and then as well, if get into those resources, we can be able to recruit competent and experienced project team who can be able to also support in the implementation of the projects. Another thing to look into, also review and establish the most donor required policies to place. One of it is the finance policy, which is a donor driven, the PCR, the code of conduct, the HR policy, the risky policy, some of these things are some of the key policies that need to be really put very well in place. And yeah, if there are others which are missing, they'll need to be reviewed and then reestablished. There's a need also for the board to take active role in performing their duties. That is the fundraising, and also look at how you can get on board the female staff. At least if you can start with the volunteers and so on, I think it would be very good in this very context that we needed a more concentration in the office. Yeah. Few lessons that we learned here is the projects implemented, they are community driven, which is something very good. This explains the reasons for this set targets to be doubled in most of the activities planned and conducted. When you look at the graphs, you plan for something small and the number goes higher. So it is meaning that it is really community driven. The breakout of the coronavirus has been also a barrier to most of the community engagements. So most of our project locations, our concentration became very minimal, not too much. So it created a little bit of, this is a negative learning actually, created a little bit of a gap in terms of our engagement with the communities. The team spirit and professionalism is key in building an institution and a strengthened partner relations. Many partners would have gone away because of the continuous lockdown in the country, but they were not able because the kind of the professionalism CECI management and the team at large are trying to show. So throughout the year, most of the issues addressed